that pounding behind your eyes, the pressure like a vice around your temples, or that dull ache that just never seems to go away. We've all experienced headaches, but did you know there are more than 150 different types, and that many can be helped or even prevented with the right kind of manual therapy? Hi, I'm Robert Hackwood, a registered massage therapist and educator. In this video, we're going to unpack why headaches happen, the 5 main different types you might be experiencing, what the red flags are, and how hands-on therapy and some simple changes can make a real difference. A headache is basically pain or discomfort in the head, scalp, or neck. But that description doesn't come close to capturing the range of what some people experience. Some headaches feel like a dull ache, others like a sharp stabbing pain, and others come with nausea, sensitivity to light, or even dizziness. Let's talk about the main categories most people fall into. Tension type headaches. This is the most common. It often feels like a tight band right around the head, or pressure behind the eyes or at the base of the skull. They're usually caused by muscle tension, especially in the neck, jaw, shoulders, and scalp. Stress, fatigue, eye strain, or long hours at a desk can all contribute. Manual therapy can be especially helpful here by releasing muscle tension, improving the posture, and calming the nervous system. Migraines are more intense and often one-sided. They can come with nausea, sensitivity to light and sound, or visual disturbances called auras. They're not just bad headaches. They involve changes to blood flow, nerve sensitivity, and brain chemistry. For many people, they're triggered by things like stress, hormones, certain foods can do it, dehydration, or even sleep disruption. Manual therapy doesn't cure migraines, but it can reduce the frequency and severity, especially by addressing muscular and joint restrictions in the neck, jaw, and upper back, areas that influence blood flow and nerve flow to the head. Even reducing a migraine sufferer's pain by 1 a month is life-changing. Cervicogenic headaches. These are ones that start in the neck. Is caused by dysfunction or irritation in the joints, muscles, or nerves of the upper cervical spine especially, often from poor posture, whiplash, or tension patterns. The pain can radiate up the back of the head, into the temples, or even behind the eyes. Manual therapists often see excellent results here because we can assess and treat joint mobility, soft tissue tension, and nerve irritation directly. Sinus headaches caused by inflammation or pressure in the sinus cavities. It's often due to allergies or infection. These can feel like facial pain, especially around the eyes and the cheeks, forehead, and can worsen when you bend forwards. Manual therapy can assist in the drainage and reduce muscle tension around the face and head. But if you have fever, a thick discharge, or persistent symptoms, you need to see your healthcare provider. This could indicate infection or something more serious. TMJ-related headaches. This one's kind of close to my heart. Jaw tension, clenching, or misalignment can cause referral pain that feels like a headache, especially in the temples, around the ears, or behind the eyes. People often don't realize their jaw is even involved until they notice a clicking, a grinding, or soreness when they're chewing. Manual therapy for the temporomandibular joints and surrounding muscles can make a big difference by improving function, reducing strain on the structures in the neck and in the head. And if you want to learn more about how the neck, jaw, and body all connect, check out my other videos on TMJ, posture, and sleep. Now that we've looked at the main types, let's talk about what's actually driving them. Some of the most common causes include muscle tension and postural strain, especially from long hours at computers or phones. Stress, which increases muscle tone and sensitizes pain pathways. Dehydration, even mild dehydration can trigger headaches. Jaw clenching or teeth grinding, especially at night. Poor sleep or irregular meals, which can affect blood sugar and hormones. Vision strain, especially from uncorrected lenses or excessive screen time. Hormonal fluctuations, particularly around menstruation, menopause, or thyroid changes. Caffeine withdrawal or overuse of caffeine, and sometimes multiple factors overlap. Tension in the neck can increase nerve sensitivity, which in turn amplifies migraine triggers, and so on. That's why it's so important to look at the whole person, not just the head. So how can manual therapy fit into this picture? Headaches are often the result of mechanical and neurological imbalance, muscles, joints, and connective tissue creating irritation or restriction. Through careful assessment and treatment, a therapist can help restore normal mobility, balance, and relaxation. Some of the main ways manual therapy can help include releasing muscle tension in key areas, like the upper trapezius muscles, suboccipitals, SCM, and jaw muscles. No, I'm not doing the Macarena. Improve joint mobility in the neck and upper back, reducing irritation to the nerves and blood vessels, decreasing stress, activating the parasympathetic nervous system, which calms pain sensitivity, improving posture and movement patterns to reduce strain in daily life, educating clients about contributing habits, like how they sit, breathe, or clench their jaw, and how to make small but lasting changes. Research supports manual therapy and massage as effective complementary treatments for tension type and cervicogenic headaches, and even for migraine prevention for some people. But it's not about loosening tight muscles. A skilled therapist considers how your entire system interacts: the neck, jaw, spine, breathing, and stress response, because they all influence how your head feels. If you're a manual therapist, I have online courses teaching different ways to influence the spine and pelvis other than the high velocity adjustments chiropractors use, as well as treating the TMJ. Use the link in the description. Manual therapy works best as part of a broader approach. That might include hydration and balanced nutrition, exercise and movement to keep circulation and muscle balance healthy, stress management, breathing exercises, mindfulness, or gentle yoga, sleep hygiene, consistent bedtimes, and limiting screens before bed, medical management if needed, like prescription medication, nerve blocks. Every person is unique, so finding what combination works for you is the key. Most headaches aren't dangerous, but there are red flags that mean you should seek medical attention right away. A sudden, severe headache that comes on like a thunderclap. Headaches that worsen rapidly or change in pattern. Headaches with fever, confusion, vision changes, weakness, or numbness. After a head injury, or if your headache is different or unusual from your regular pattern. These could indicate serious conditions like stroke, infection, or aneurysm, and they need urgent care. If you ever are unsure, get checked. It's always better to be safe. Headaches are incredibly common, but they don't have to control your life. Understanding where they come from and how your body works gives you the power to make real changes. The sternocleidomastoid muscle causes pain in the face, forehead, back, and top of the head. Here's a video to help get this muscle under control. Thanks for watching, and take care of your head.